One of the biggest questions is, how did I get this and how long have I had this? When people ask me how they get it, the reality is we don't know. For some cancers, we're able to clearly delineate an exposure or some other component of their medical history that led to this. For most patients with myeloma, we really have no idea how they got it. The big question about how long they've had it is another really nebulous one. We now know that essentially everyone who develops myeloma had some earlier version of a benign process called MGUS. So people could have had these benign processes for years, if not decades, before they actually manifest as myeloma. So the actual symptomatic myeloma itself may have only been occurring for a period of weeks to months, but the whole process could have been there for years. Other questions that are asked are, can I pass this down to my children? Is this a hereditable disease? Many people think about hereditable diseases like breast cancer, where you see a mother and a sister and a child all have breast cancer. In general, we classify cancers as either sporadic or hereditary. Sporadic are just cancers that pop up. Hereditary are ones that are passed down. Myeloma, the majority of it is sporadic. Most people do not pass this down. There are a handful of clusters of familial myeloma where we see this in certain families, but it's very, very rare. In general, if you have a first-degree relative that has myeloma or a similar disorder, your first-degree relatives, so brother, sister, mother, father, son, or daughter, have a slightly higher incidence of getting this over the general population. But where in the general population it may be 1 in 100,000, for you it may be 2 in 100,000. So I say instead of 1 needle in a haystack, it's 2 needles in a haystack. Overall, still very unlikely to develop something like that.